Mr Speaker, I rise to speak on the appropriation bills with particular reference to the report on the estimates process of the Health and Environment Committee. You don't need to look very far to find a recent story on the worsening healthcare crisis in Queensland. Whether it's about long wait times for appointments, lack of access to basic healthcare, spiralling costs of services, the availability of medicines, or burnout amongst healthcare staff, which do a great job in providing what they do here in Queensland, and I take my hat off to them every day and night that they have to work under the situations. At the estimates hearing, we heard that ambulance ramping has worsened to 45% across Queensland, and that there are now almost 60,000 Queenslanders waiting for elective surgery across the state. Meanwhile, Queenslanders with suspected cancers are being kept waiting months to receive the results of their biopsy scans and MRIs, putting many patients' lives at risk. Pathology Queensland confirmed that at one point things go so bad that they were forced to send some scans to Victoria for testing due to the enormous overload they were faced with. Then there's a decline in Queensland's with private health coverage and chronic shortage of medical staff across all areas within healthcare. At estimates, the minister revealed that 584,431 people presented at Queensland's emergency department last quarter, the highest recorded amount in the state's history. This growth is placing enormous strain on our ambulance service, with patient off-stretcher times post-steady at 55%. All of these issues are even more acute in the rural and remote areas. In my own electorate of Morenni and surrounding regions, there has been a big drop in off-patient stretcher times at both Mackay and Rockhampton Base Hospital since 2015. And according to Queensland Ambulance Service data, the average post rate at Mackay went from 95% in 2015 to 73.5% in 2021, while Rockhampton Hospital dropped from 99% in 2015 to just 52% in 2021. A recent report by the Queensland Audit Office found that for the period from July 2020 to February 2021, only one of the top 26 reporting hospitals in Queensland met the 90% target for both patient off-stretcher times and emergency length of stay rates. The Auditor-General notes that overall post-performance for the top 26 reporting hospitals has decreased from 88.9% in 2014-15 to 68.5% for the period of July 2020, February 2021, and in 23 remains steady at 55%. Both the Auditor-General and the Minister attribute this to huge decline in standards to the increasing complexity of emergency department presentations in Queensland. And since 2015, Category 1 presentations, immediately life-threatening, has grown by a massive 41%, while Category 2 presentations, imminently life-threatening or very severe pain, increased by 50%. Maternity units remain under considerable strain across the state. The Biloela and Gladstone Hospital maternity wards have been out of commission for many months, forcing women to travel significant distances to Rockhampton just to have their babies. Some having them on the side of the road, I believe. Currently, we have no maternity services at Weipa, Chinchilla, Biloela and Cooktown, and no indication when these services will be back online. We need immediate and long-term solutions to address maternity healthcare access in regional Queensland, including better incentives and workforce rotations. The additional stress, uncertainty, cost and risk of the lack of maternity services is causing people in regional Queensland is unacceptable. This should not be happening in the first world country or a first world health service, and the crisis in maternity healthcare access is being replicated across the healthcare more widely. It is time we saw a restoration of critical services to deliver appropriate care across the whole healthcare system in Queensland, especially in the regions, Mr Speaker. We need more recruitment, more and retention initiatives and incentives, better workflow management and better funding to make it happen. We also know that attracting doctors and nurses to regional areas is made much harder by the lack of housing and the lack of schools and the lack of social infrastructure. Services need to be designed to meet the needs of diverse communities in consultation with the communities they serve. The government needs to start listening to this. Improving the lives and the health of people in the regions requires a holistic approach, not the same old one-size-fits-all model we are seeing fail time after time. Above all, we need real action, and there's not a lot of action here on this health space and even some of the environment space with the renewables as well, Mr Speaker. The situation is getting worse, and regional Queenslanders have been waiting far too long for the access to basic health care they so desperately need. Thanks, Speaker.
Mr. Acting Speaker.